Drug companies will have to train health professionals to safely prescribe the drugs. Here to explain all this, Dr. Chris Gharibo, who's Director of Pain Management at NYU School of Medicine. First of all, this is, as I understand it, a voluntary program. Do you feel, though, that it goes far enough? Are you happy with it?
Generally speaking, I don't think it goes far enough. It only covers long-acting opioids. It also needs to cover the more common painkillers, such as, for example, Vicodin and Percocet. And the bottom line is that it's not mandatory. It's something that's elective. And what we do know is that during our training, we don't get enough experience and enough knowledge to prescribe these medications.
But if this is giving you more experience or more knowledge, is it a step in the right direction?
It certainly is a step in the right direction, but it needs to be more comprehensive. I think also a lot needs to be done at the medical school level and at the residency level to increase the education.
Why not make it mandatory?
Well, it's headed in that direction. I think it may occur, for example, at the hospital level. For you to be credentialed at a hospital, you may have to take a course and do well on it. For you to be able to get credentialed, it can occur at the state level, where for you to get your DEA license, you would have to take a test and do well on it. But I think it needs to be much more comprehensive and be at the federal level.
So what's the problem here? Doctors don't understand or appreciate the fact that people can become addicted to these pain-killing prescriptions, and before they know it, there's real trouble.
I think it's something that we understand and acknowledge, but often we underappreciate and not do enough about. I think there's a lot of opioid prescribing where we just over-rely on the narcotic as opposed to a good combination plan that incorporates medications that are not opioids, as well as a good physiotherapy plan and a psychological plan to bring it under control, because often it's more than just pain. It's much more complicated than that.
Okay, but why aren't they teaching this at the medical school? Isn't that what medical schools are for?
Well,
teaching doctors?
Absolutely. I mean, it's something that we just began to understand in the last decade or so. I think at the medical school level, we concentrate at the organic level, at the liver, kidney, stomach level, and so on, and we tend to focus on that, but the pain is much more difficult to understand.
How serious is the problem? Because some of the numbers I was reading are staggering to me.
It's huge. It's an astounding problem. It's a growing problem. Currently what's happening is that there are more people that die from opioid misprescribing and opioid overdose than car accident-related deaths.
In car accidents.
What are we learning about pain?
What we're learning about pain is that it's not as simple as just treating it with a single medication. It needs a more comprehensive plan. It needs a biopsychosocial plan to bring it under control.
What does that mean, biosocial?
That is going to be a good clinical indication. You got to take into account the patient psychosocial circumstances as well. But we got to sort of step away from just looking at pain scores. We've got to look at the patient's function, putting them back to work. A good psychological and social and physical function is the endpoint, not a pain score.
And what about something like doctor shopping, which we've heard more about in the last few years? Is some of the onus on the patient?
I think patient education needs to be part of it as well, and it is as part of this FDA initiative. I think doctors need better tools to prevent doctor shopping. It's something that's quite pervasive. I mean, you have patients traveling hundreds of miles or thousands of miles across state lines just so they're not tracked and getting multiple physicians prescribing to them.
Is there a way to prevent that if you're talking about these distances?
Yes, there is. It needs to occur at the state and federal levels, but there could be real-time prescription monitoring.
And are you talking about specific types of pain? You know, because pain is such a broad category, Dr. Gharibo. It can mean so many different things to different people.
Yes, I'm specifically referring to chronic pain, low back pain, migraines, a whole variety of different chronic pain presentations, not acute pain. But it starts at the acute pain level. Often you may get your knee replaced and then you're given, let's say, 90 Vicodins or 120